The Pearlsteins are here, and I am guessing that you guys, all of you on different levels maybe, there were moments where you could absolutely relate to that story too, because you have your own story, and I'm so excited, particularly to talk with Elena. Yeah. Thank you so much for being with us today. I know it was hard to miss school, right? But Elena Pearlstein is a 6th grader, still in her uniform. Does that mean you went this morning?
Yes.
Okay. And so I want to hear about your journey. And I'm going to talk with you first because I think we really want to hear from you. But can you just tell us a little bit about, tell us about yourself.
Well,
what do you like to do?
I like to sing, and I like to play the piano, and I love to read.
So when you had a hearing loss when you were younger, how young, by the way?
Elena passed the newborn hearing screening, but it took 7 tries. So there was no history of hearing loss in either of our families, so this wasn't on our radar. But in hindsight, we recognize she probably had some hearing loss from the very beginning. And it wasn't until about 1 when we discovered or noticed that she wasn't doing the typical babbling and experimenting with sound that we often hear, and that's when we brought the concerns up to our pediatrician. So that kind of started the process of figuring out, what's going on here.
And so what happened next? I'm going to ask your parents because you probably don't even remember that early on, right? So what happened next? One of the first things they tested again probably was the hearing.
Yeah, so the first thing they did is test the hearing, and it was discovered at the time there was fluid in the ear. So the first immediate fix is, okay, we can put tubes in, and this may fix the problem. So they did a tube surgery, and shortly thereafter, we brought her back in for an evaluation. He said, looks good. The hearing, you should start noticing improvement. 3 months went by and really no change. So we had another evaluation done, and sure enough, there was hearing loss. So that started the process to actually get the hearing aids. I think it was close to 2 years by the time she actually got the hearing aids.
I'm going to ask you to be a news reporter, and
Yes.
You're going to hold that for your wife too, Michelle.
Yes.
So Michelle, now you have a beautiful daughter, and you're thinking, okay, we're dealing with hearing loss. What did it blindside you? Did you just jump right in and say, okay, what's next? Tell me about that time.
I had taken Elena in for the hearing test that time, going in thinking that we would find out that there was nothing to worry about. She just had a speech delay, that it was, no big deal. And then I was told that she had a hearing loss, and I remember the audiologist was talking to me, and I picked Elena up and I walked outside to the car and I called John and I said, you're not going to believe this. She actually has a hearing loss. And it just kind of hit me like a ton of bricks. It wasn't at all what I was expecting.
And when you hear hearing loss, obviously there's many levels of that, but it was significant, right?
Well, she started out with a mild hearing loss, but it was a progressive loss. So it got much worse. Within a short period of time, I'd say within the first year or 2 of her diagnosis, we watched that mild loss become a moderate and then a severe loss.
Did you know that was going to happen?
Not until it started happening.
So you had to take her in how often? Every 6 months for?
I think it was even more frequent than that. I think we were pretty much living with the audiologist at that point.
And did you know when it would stop, the loss?
No.
And that's also what's difficult about this is when we would ask that question, they said it could stabilize here or it could keep going, and we won't know until it actually happens. And it's it's that uncertainty that kind of plagues you. It's like, well, what do we do? What can we do? And it's difficult to work through that uncertainty.
Was Elena learning any sort of signs to communicate to you what she needed?
We were trying to do some baby signs with her, but she wasn't really taking to that. She seemed to want to talk, but she wasn't getting, the feedback, and her speech was really delayed, and it was becoming very frustrating for her. So as a 2 to 3-year-old, we were also starting to experience some behavior problems because she was getting frustrated that she couldn't communicate what she wanted to communicate.
A lot of people don't realize that communication equals behavior. Mm-hmm. And a lot of children have terrible behaviors, and really it comes down to language delays or inability to communicate, and that's the most frustrating thing for them. So at what point did you get to the point where you thought, okay, what's going to help her? So you're kind of on this slope, right? With the loss, the loss. And then where did you kind of stop and then start getting hearing aids? And
well, as soon as she got the diagnosis of a hearing loss, she got hearing aids almost immediately. But it wasn't until recently that she got the cochlear implants.
Right, and we're going to get to that. So how long, do you remember how long you had hearing aids, Elena?
I don't really know. I know that they told me is that I got hearing aids when I was 2. That's also when I started like speech, and so I still do speech, but
What were those hearing aids like for you? Do you remember?
Well, the last time I remember is when I was in 3rd grade. I mean, one of the things that was annoying is that sometimes holes, like there would be like a rip in the tubing, so the sound would also go out, and everyone else could hear it, and it was really annoying.
I bet a little bit embarrassing too, was it?
Yeah.
Yeah, that's tough when you're a kid at school. And so did your friends at school know that you had them? They could probably see them, right?
Yeah.
And did you have to find yourself explaining to them? Or only new kids?
At the beginning of the year, my hearing itinerant comes in to the classroom, and she kind of like gives a presentation.
So when you were in the classroom and you had someone explain to your friends and your peers what it meant to have these hearing aids and what you needed probably to communicate, was it easier for them to look you right in the eye and talk with you? Or was it easier for you to sit in the front of the class? Or what did you need to learn from the teacher?
Well, one thing we really tried to work on in the classrooms were like no calling out and no just like making extra noise, like if you had a pencil, no just like tapping it on your desk, because that's really annoying and distracting. But calling out was probably one of the biggest problems. So.
What was the, I'm going to ask you 2 things. I would imagine that the lunchroom, if you had a lunchroom, could be tough. And maybe the playground?
Well, the lunchroom, it was small, and they had wooden floor, so it was really loud, and I couldn't really hear my friends. So I would always have to ask them to repeat what they said. So.
And if they're your good friends, they got used to that, right?
Yes.
Yes, that's right. And the playground was okay? Did you do any sports or anything like that?
Well, on the playground, it wasn't really. On the playground, sometimes I would just walk around, just looking at things.
Yeah. Did you ever find that you wanted just kind of some quiet time?
Yeah, on the playground, or sometimes at lunch, I would mostly just be quiet, thinking to myself. So.
Okay, I'm going to stop you there because we're going to fast forward just a little bit. So you wore hearing aids for a number of years, and then we got to the point, Mom and Dad, where it was time to consider, at least, a cochlear implant. So tell us about that process.
So we were noticing with Elena, as the academic demands in school increased, that she was starting to fall behind. And we began to worry that possibly there was something else going on. Maybe she had a learning disability, or there was something that was preventing her from achieving to where we thought she could achieve in school. So we had taken her for an evaluation with a psychologist that specializes in hearing loss. And basically the end result was, why doesn't she have why doesn't she have cochlear implants? Why is she still wearing hearing aids? Which started to make us more aware of the fact that the hearing aids weren't doing the job. At the same time, we had started to notice that she was starting to isolate herself a little more socially. So we knew at that point it was time to.
Oh, that hurts your heart, doesn't it?
Yes.
So the cochlear implant happened when? or implants, I should say. There are two, right?
Yeah, so my first one happened last year, May 25th.
A day you'll never forget, obviously.
Yeah,
So which ear was first?
my right side.
Okay, so you went in, and what did you think it was going to be like?
I didn't really have any idea. I wasn't really thinking. I was just excited because I knew I was going to be able to hear better, but I didn't know what it was going to be like.
So you thought it was just going to be better, and you were ready to get rid of those old hearing aids, right?
Yes.
Okay, so you woke up, and you have this implant. Is it turned on immediately?
No.
Okay. So then what happens?
Well, I woke up. I remember feeling tired and confused. So, they took me to a room and I saw Mom and Dad. And then I, remembered. Then, I kind of lost my balance. So I didn't really have my balance for like a week or something. So that part wasn't really fun.
I guess you felt a little clumsy, right?
Yeah.
But the ear is so important to your balance, isn't it?
Mhm.
So then when does the implant get turned on?
Probably like 3 or 4 weeks after the surgery.
Okay. So you went into the center or the doctor's office, right?
Mhm.
And they turned it on. Who was there?
Miss Virginia. No. Miss
Okay.
Virginia.
Were you guys there too? You bet you were,
You
right?
bet.
Yeah. So what was that like?
It was really exciting. But like when they first turned it on, it was kind of hard to understand, like the sounds around me, because I had to basically learn how to hear from my right side. So, so yeah, I sounded weird to myself, and Mom and Dad sounded weird. And sometimes I found myself relying on my hearing aid more because my right side still sounded funny. And so I didn't really like it. So sometimes when you don't really like something, you try and avoid it.
You go back to what you're used to because you
Yeah.
knew what the hearing aids sounded like.
Yeah.
But it also shows you how much different and the kind of impact that a cochlear implant can make. I mean, it's significantly different from your point of view from the hearing aid, right?
Yeah.
When did you start to appreciate it or like it?
Maybe, I think when I started 5th grade, so like a year ago.
Because you said you like to sing, right? And you like music. How did having the cochlear implant help you sing and appreciate music better?
Well, with the cochlear implant, I can hear the notes better. And, like, sometimes when you're singing, you pronounce words differently, or else it sounds weird. So, that helped me. The cochlear implant helped me a lot more.
Did you have to go through several months where Elena was saying, I don't like this thing?
At first, it sounded very robotic to her and very electronic, and she had to learn how to hear those sounds again. So it definitely took a while, but the more time that went on, the better it got, and she really, really started to appreciate those sounds. And just as you indicated when you mentioned this, she was having trouble before with the hearing aids with the higher frequencies, and the cochlear implants really helped fix that whole part of the spectrum. And it gave her access to so much sound that she wasn't getting before. So it really made a huge difference.
So you're like, bring on the next one, right?
Yeah.
So how long have you had both now, approximately? Less than a year?
Yeah, July, she
Okay.
just got the second one.
Wow, fantastic. And so was there the same adjustment period, or you knew what to expect this time?
I knew what to expect. So this time it wasn't like as hard, and I kind of understood more. So it wasn't that confusing, and it wasn't so hard, and it didn't take me as long to understand other things.
So how is life in the classroom now? So if somebody does this with their pencil, does that bother you?
Well, I like that my cochlear implant, so if there's too much background noise, or if it's too loud, my cochlear implant will automatically lower the volume, so everything's not too loud for me. And in the classrooms, I use my mini mic, and the teacher wears it, so I hear her instead of other,
very good,
extra noises.
That's awesome. And you have a lot to teach other people.
Yeah.
You've come a long way. I know your parents are so proud of you. What's your favorite kind of music?
I don't know. I like a lot.
I'll put you on the side. You like a lot? All right. Well, keep singing. And I think your speech is beautiful.
Thanks.
You're really doing great. Thank you so much for joining us and sharing your story. Loved hearing it. And good luck with 6th grade. Okay?
Okay.
And I hope you've got an excuse to miss today.
Thanks for having us.
They'll watch it on Facebook. Thanks so much, Elena. Thank you. And we have someone else who has experienced hearing loss and really gotten help. And we want to get to everyone because it's great to hear these stories. Barbara, did you bring your parents? Bye, Elena. Thank you so much for joining us.
Thank you.
Barbara Kraska.
Yes.
I'm going to scooch in. You know what? Don't mind me. I know. Scooch a little closer so we don't have to sit so far apart. There we go. And I want to hear your story. So you were hearing, I'm sure you recognize the doctors and the audiologists, right? And everybody.
Yes,
yep.
Dr. Kaplan, my
Yep.
great surgeon, yes.
Yeah, and you're so thankful for them.
I am very thankful. Yes, it's changed my life.
Yeah,
no doubt. Very quickly, it changed my life. Yes.
I have a feeling that your story is a little more typical. Was that, do you think?
I suppose it's. I don't know really. Yeah, more typical, I would say, than Elena's. Yeah, yes. Through the years, mine was more progressive. And through the years, I knew that as I got up a little older, that some words, I just was not able to quite understand. I didn't understand all the words, and sometimes I was responding incorrectly, and it became embarrassing to me, and all of a sudden, I suppose it was around... looking back to about 2005 when I was getting ready for our son's wedding, and it was away, and prior to that I had gone to the audiologist to get checked, and yes, looking back then, I guess it's since 2005, I don't remember if it was moderate or what, somewhere, but I did need...
Did someone encourage you to get checked, or did you do it on your own?
I did it on my own, yes. And the audiologist said, yes, I needed hearing aids. And then I remembered them giving me a book to read. And on my way to South America to the wedding, I remember just reading through the whole thing. And then I became kind of more excited about what I should do for myself then and what I needed to do.
So you weren't worried? You weren't worried?
No, not at all. No,
okay.
No.
Did you beat yourself up a little bit for waiting so long, or do you think you were pretty on top of it?
I was pretty on top of it, but actually I could have started before. It did take me a while because it was in denial, People would say, Mom, my daughter's son's was, Mom, you need to go to get hearing aids. And I would just take that personally, and I was in denial as, it's crazy you're thinking about stuff
No,
like
I think
that.
it's very typical.
Yeah,
I think you're definitely not alone in that. And that's what I wanted to hear, because when people can hear other people say,
Yes.
I wish I'd done it sooner, or I wish I'd really been on top of it,
Yes.
it might give someone else the inspiration to do the same.
Yes, I wish I had done it a bit before. I would have been better off, because in my business in reflexology, it was so important for me to hear people correctly.
Sure.
And I became embarrassed sometimes when I would get things mixed up a little. And so then, anyway, when I made up my mind to do it, I saw how important it was.
So talk about getting the hearing aids and what that was like.
Hearing aids just really opened up quite a bit, and as Dr. Kaplan explained, it makes things louder, but then you go into public places, and then you got that background noise and trying to hear the menu that they're telling you that you don't quite get it all, and having to get somebody else repeat it, or even to watch a movie, sit and watch a movie and not get all the words, and my poor husband had to stop and repeat some of it to me. go to parties, it was just way too noisy, and I would just get disgusted and walk out, you know.
Did you find yourself also sort of isolating a little bit?
Yes. Definitely, yeah. There were times when I did that. Yes, that I thought, you know, I can't really figure out whatever everybody. If it was one-on-one, it was okay, but it was like a lot of noise around me, and it was very, very frustrating.
So you were constantly sort of struggling with finding the
definitely.
right. And then I'm guessing that that's the point where you said, "What can I do beyond this?"
Yes. That's exactly what it was, yeah, when the audiologist had, you know, turned it up as high as she could go. And
You're like, this is it.
Everything she could, this is
all
it,
the engines
you know?
are running. And
But this one, you need to, why don't you think about a cochlear implant? I said, well, what's that? I was not familiar with it at the time. And of course, I went right home and got on the website and started to check into it and hear what others were saying. And then all of a sudden, I got real excited. I want to do that. And I called her, Dr. Regina right away and made an appointment.
So how long have you had your do you have one or two?
One in the right ear, May 7th of this year.
Wow.
Yeah.
So walk us through it. What was that like, and what was the recovery like, and how did it change the way you hear and interact with people?
Oh, it went very well, and so they tell me, both Mary and Dr. Regina, that how well, I know my hearing is altogether different, and when I go for the test, you know, it's just better and better and better every time. The whole procedure went well. I just would highly recommend it to anybody. It just is a life-changing experience.
And did they turn yours on right away, or did it?
30 days after, May 30th, mine was turned on. Yeah,
okay.
Almost 30 days.
And what was that moment like?
That was kind of weird in a way. It was good to where I was able to hear differently, but it was different, and kind of like Elena just said then, it was also a lot of other noise, because remember, my brain was working here now and bringing all of that back and trying to figure out what that sound is.
And your brain had heard it before,
whereas
Elena had never some of these
exactly.
sounds.
They were different where she didn't hear, but I did, but I wasn't hearing as not as well as I should have heard. And then as time went on, and then the noise is slowly disappearing to where now it's almost nothing, just almost complete, total great hearing.
So how has it changed your life? And does it make you realize how long you went not hearing certain things now that you can hear them now?
It's changed my life a roundabout turn. I'm excited now to say to my husband, get a movie. Let's watch a movie tonight.
So you're like 10 years younger.
Exactly. Before I would walk away and read a book. And now I'm interested to watch TV because I can understand what's being said now. I mean, I love to go to any public places. And I love to go to restaurants. And when the waiter or waitress gives me the menu, I can hear what he said. The last one, my husband even said, did you hear that? I did. I said, yes, I did.
Do you tell him maybe he needs to get his ears checked?
Get your ears checked. Yeah, I was starting to, I really feel very normal now. Yeah.
So when Dr. Kaplan was talking about, I know that you heard him, about how hearing loss they're finding can lead to dementia and depression, you can probably appreciate that, because look how much more engaged you are now.
Yes, yeah. I mean, like Dr. Kaplan said, there's just so much can be said about dementia, but certainly I believe that is could be definitely a part of it. Yes, because what you do to yourself, the isolation, and you don't have a positive attitude. You're not feeling good about yourself.
It's amazing still how many people aren't aware of what cochlear implants can do, and so you're a great spokesperson for that.
Well, I would love to do anything I can just to show others, it's never too late to do it.
Right. Mm-hmm. And so your experience at this is a rhetorical question because I already know the answer. Your experience at GBMC, it sounds like it was just really...
Oh, those people, from the time you walk in through the door, from Nikki at the receptionist, on to Mary, the speech pathologist, to Dr. Regina, Dr. Kaplan. I mean, I just have never seen a team of people the way that they are. They are wonderful. I look forward to every time I go back. I love them all. And Dr. Kaplan, my family still say, what a wonderful doctor. He kept coming out from from when he finished the operation, going out into the room and explaining to them how it was, what happened, and he was just wonderful. So I'd highly recommend him. Yeah.
It's a gift, and it's a gift that you came here to share your story. Thank you so much.
Thank you.
So we can all say, hear, hear. I've been waiting for an hour to say that. But also just thanks to all the hard work being done at the center. And just one more time, the Presbyterian Board of Governors Cochlear Implant Center of Excellence at GBMC. I think it's one that people are going to remember for a long time.
Am I expected to remember that too?
Yes, you're expected to say it. No, I think they just want you to hear it.
Okay.
Right? Anyway, that's all for us for this hour. Thank you so much for being with us. And thanks to our great studio audience as always. And we'll see you next time.